Hi, I'm Trish. Someone asked me a couple of weeks ago, I think it was a couple of weeks ago now, I don't know, if I'm scared going into surgeries or if I'm scared about having surgeries. Quick and easy answer to that is hell yes. I never used to be, but I've had a lot of surgeries over recent years. I think I worked out I've had total of about 14 surgeries throughout my lifetime, not including colonoscopies and gastroscopies. And the only surgeries I'm including are the ones where I've, actually had to have an anaesthetic, like a general anaesthetic. A few of those have been very big ones. I've had 2 caesareans, I've had an open gallbladder surgery, I've had massive breast reduction, I've had an extended tummy tuck with fleur-de-lis. So yeah, I am scared going into them. You'd think that I wouldn't be now. You'd just think that I'm used to it now, and it's all, I'm familiar with it all and everything. And I am. I know what's going to happen. I know the procedures. I know everything from being put on the list to being put on the table and afterwards. And I'm normally okay until they get me into that little pre-op room. Before they actually take you into theatre and they do the IV and like everyone in the hospital is in there buzzing around and checking things and putting monitors on you and asking a million questions and getting you to sign things. That's normally when I lose my shit. And I beg for Valium when I go into the hospitals. I go in and I say, I'm really nervous. Please, can you get someone to come and see me, get a doctor to come and see me and give me some Valium, because I'm an absolute wreck. And they always refuse to, which shits me to tears because I know it can be done. But anyway, and the reason that I do get anxious is, and this is not to scare anyone off from having surgery, but the question was asked, so I will answer it honestly. I've had bad shit happen, and when I say bad shit, I don't mean I think it's a bit naive to expect that every single surgery is going to be a completely smooth procedure, in that you won't have any pain or nausea or things like that. I think it's, although I have had painless surgery before, I have woken up and been in almost no pain, but for the most part, if someone's cutting into your body, you're going to be in pain afterwards. But the thing is, when you wake up, there's a nurse there and they ask you what your level of pain is, and if you need medication to help with the pain, they give it to you. And then if that medication makes you feel sick, as it does for me, they give you an anti-nausea medication, and that normally works really, really well. Now, having said that, after my breast reduction and after my big gallbladder surgery, they maxed me out on all the painkillers they could give me without actually killing me. They maxed me out on all of the anti-nausea medications they could give me without killing me, and I was still in pain. I was, particularly with those 2 surgeries, I was in horrendous pain, and that's another thing. They can give you pain medications, but it doesn't necessarily mean it's going to take away all the pain, but it really, really helps. For the most part, it really, really helps. But even so, I spent one night, the first night after my big breast reduction, in terrible pain. Oddly, not so much from the incisions, but from my back. I've got a couple of bulging discs in my back, and I imagine they would have had to move me around quite a lot because my incisions go right all the way around to my back. So that was the pain that was really that was giving me grief. But it was only that one night, and then by the time morning came around and they were able to give me more anti-nausea tablets and then, more painkillers, so the pain went away. So it wasn't forever. And, I'm sitting here 2 years later and I'm okay, Even after my gallbladder surgery, when the pain was so bad I thought I was going to die, it didn't last forever. That one lasted for about 3 weeks, that awful, awful pain after that. But, again, I'm alive. I'm okay, but it's those few little things. And I have had occasion where I've woken up from an anaesthetic when they, part of the general anaesthetic that they give you, they put in, not all the time, but sometimes depending on the surgery, they'll put through a muscle relaxant medication as well, which they need if they've got to put a tube down your throat, and particularly if you're having a tummy tuck, they need your rectus muscles very, very, very relaxed to be able to stitch them together. And they normally reverse that medication with another medication at the end of the surgery. And I had an instance where that the timing of that was a little bit off. And when I woke up, I couldn't move, I couldn't speak, and I felt like I couldn't breathe. I actually could breathe, but I felt like I couldn't breathe. And I was trying to reach out to the nurse to say to her, help me please, I can't breathe, but I couldn't move, I couldn't speak. But again, I'm here, I made it through, and all I could think of during that time was, if worse comes to worse, I will actually pass out. I will, if I'm not able to breathe, I will pass out from lack of oxygen. They've got me hooked up to monitors, alarms will go off, they'll see that I'm not breathing, and they'll, once I pass out, I won't know about it, and they'll re-intubate me and I'll be okay. I'm in a hospital, I will be okay. It would have been a very awful 2 to 3 minutes though before I passed out, but that didn't happen. And I've had fainting after surgeries. That all gets dealt with. I always used to be terrified about fainting, and now I've done it, and I was very relaxed. I'm a weird fainter. Most people, when they faint, they faint and it's like they're asleep. They're completely unaware of anything going on around them. When I faint, I can't move, I can't respond, but I'm aware of everything going on around me. It's very, very weird. Apparently it's quite rare for people to do that, but that's me, that's how I do it. So you get through that. After my tummy tuck, I wasn't able to wee, so they had to put a catheter in. That's no big deal. It's nice not having to, get up or use a bedpan to wee. And then, once everything's fine again, they just take it out. It's really no big deal. I can't even really say it hurts. And then, you've just got to decide, whatever surgery you're having, whether it's weight loss surgery or a tummy tuck afterwards, or, whatever you're having done, if it's a surgery that you have to have to save your life, then, you just got to find a way to get through that. If it's something that you're tossing up whether to have done or not, that's completely up to you, and your team of doctors and anaesthetists and everything will check you out. I'm sure that you'll need to have blood tests, and if they think you might have sleep apnea, you'll need a sleep test, and you'll need an ECG, and all this sort of thing. They don't just get you in off the street and put you on the table. They need to make sure that you're healthy first. So, they'll talk about that with you, and then you can decide if you have any comorbidities, if it's worth it for you. So I'm not going to sit here and say yes, you should have the surgery, or no, you shouldn't have it. That's completely up to you. It's up to you to weigh the pros and cons. You'll have scarring. That's unavoidable. It's just up to you to decide if it's worth it. And you can have complications, particularly from like plastic surgeries like tummy tucks and stuff. You can have seromas and hematomas and swelling for months on end, and pain, and you can have wound breakdown and all these things. I've seen it a lot in the groups. I'm in a lot of groups, and I've seen it happen a lot. Everyone gets through it. You can do things to help yourself before going in for surgery. Make sure that you stop drinking alcohol for at least a couple of weeks beforehand. Give up smoking. Eat well. Go hard on the protein prior to surgery, because that's really good for you. And exercise. Get yourself as fit and as strong as you possibly can. I did all those things, and it really made a big, massive difference for me. Do what you can for yourself, and find a team of doctors and surgeons who you trust, and then, weigh up your pros and cons. But yeah, to answer your question, I am shitting myself, and I'm having surgery next week. I'm having surgery in 1 week and 2 days. I'm okay today, but getting close to the date, I am going to be nervous. I am going to be nervous that they won't reverse the drugs properly, and that there'll be complications and all this sort of stuff. It's very normal, even for someone as seasoned as I am at surgery, to have these worries. So that's I don't know if that helps you or not, but that's my view on it. I'm not here to tell people what to do. I can only tell people what I've done and how I feel about things. So that's it.